ولقد أرسلنا موسى بآياتنا وسلطان
My name is Amadou Sohna. I'm a medical doctor, a surgeon in training. I came from a family of 4. I'm the first child. So I was brought up and raised in Banjul, Bakau, and we lived here. When we lived in Bakau as a first child, I would help my mom to do all that we were supposed to do at home, ranging from going to the market to cook, to buy for her, coming to cook, and then going back to sell for her for the business. And this was again to help and support the family. The people that I went to primary school with will tell you that I started calling myself a doctor at that level. And I grew up realizing that one of my biggest joy is seeing somebody who's sad or seeing somebody who's on the ground and trying to lift them up. And I believe practicing as a medical doctor is what is just going to give me that joy of helping people on a daily basis. And there is no joy better than somebody who's coming worried sick or who's coming with lots of illness, and you help them restore back to health, and they look at you and say thank you. It's the biggest joy. And that for daily living, it's just why I choose medicine, and then I will choose it again and again. So we work in an environment where the resources are so low. We work in an environment where we are able to do things, but we cannot because of some simple basic things that the government cannot provide us. School? Huh? I get school. Wow. One class guy I got Grade 6. Grade 6. Wow. So that's my exam over there. One exam. Not only the exam. I still have difficulty with understanding why people don't believe that there is corona. But as you rightly said, there are lots of people who still don't believe that corona do exist. The challenges that you have to deal with as patients that you see is that some of them you have to, because before you're able to do a test, you have to consent them. Consent them means is that asking for their permission to be able to do the test. Sometimes blatantly they refuse because they don't believe corona exists. Or sometimes you get to the point of making them accept, getting the test results come, they turn out positive. Accepting that results also is another challenge. So the challenge really is having to do with people's belief. I didn't only survive corona. I had also had a patient that turned out positive, who I operated, and then I had to stay away from home in quarantine for 2 weeks. Coming out of the quarantine after 3 weeks, and I had turned out positive. So it had taken up almost 2 months of my life, but that's fine.
Easy. You already have opinion.
Psychology-wise, I've been fine. I understood that this is something that can happen to me. Physically, I got really sick, and I had to battle with being able to have the strength to eat and stand for about a week. So that was the difficulty that I had. But otherwise, I understood that this is an illness that can happen to anybody as far as you're in the environment, and that's kept me going.
When he tested positive, we took it in good faith, as his wife, a doctor as well. I knew that I had to be there for my family. It was devastating because we have our old man here, Dr. Sohna's, my father-in-law. who is both hypertensive and diabetes. So from research and from literature, we all know that COVID is has more impact on people with comorbidities than we strong youths and all.
So Abby is it's my younger brother's daughter. She is the first child of our family, and naturally, she is our first daughter. And as the head of the house, I am the first child. It naturally makes her my daughter, and that's how and why she is close to me. And it is one of the most difficult things when I got sick before getting sick was when I got quarantined, was having the fact to know that I had to be away from my daughter for 2 weeks. It's painful. When I come from work, like when I do on calls and I spend more than 24 hours at hospital, when I come and she's sleeping, before my greeting is being answered to, the first thing they tell me is that don't wake her up, because the first thing that I do is to go around and play with her and catch up with the past that we have missed. So it was one of the most difficult things. It was, to me, much more difficult than even the coronavirus, to be honest. My department, basically, we had a lot of us that were positive in surgery. I don't know if we were the only department that we were testing, but we had a lot of people who tested positive. And honestly, it didn't change. What happens is when you come back, everybody embraces you back to work. Because again, if I miss work, means that there is a lot of work that is pending on my colleagues. So they're eager to have you back rather than staying home because you're sick. So there is no stigma at work, to be honest.
Frontliners being exposed is not something new. We are 17 times more prone to this infection than others. But the fact of being exposed daily and dealing with patients that we don't know their status. Some patients are in critical condition, they have difficulty in breathing, they are coughing or not. That will be the least of our concern. And looking at our condition and the constraints that we are working in, sometimes you're not in appropriate jerseys, sometimes you have to take the risk and do certain things. It is just unfortunate, but we still have to do the job.
My perspective in life is that you don't just have to sit and wait for it, but you go as a go-getter and get it. So what that means is that if the government is not giving us what we need, means that we as citizens should go to the extra mile in providing. We go to the extra mile in making sure that these gaps are filled. So my activism in terms of coronavirus, really it has to do with, it's just started with talking to the people. When it came, in the first months, what I was doing entirely was just talking to people. So talks were on the TV, on the radio stations, on Facebook, on Twitter. So then we realized that it's not only talking, but we have to go out to people and give. So we mobilized funds, we mobilized stuffs, and then we were able to go to the community, give them masks. We were able to also go to our colleagues in the hospital to get them PPEs. We were able to go to our colleagues that were sick to the treatment centers and give them medications that were not available, from the government. has just changed the world, and our activities included as well. So I will agree to say that COVID has lessened the amount of interactions that we're able to have with people directly.
What God lad is more than 60 years or 70 years, at some point more than 80 years.
What COVID has taught us is that the forgotten traits that we should have as a nation is that it is us to come together as a nation to develop this country. It is us to come together as a nation to move to wherever we want to. And then we should also realize that COVID is a true thing, it's a pandemic that had affected the whole world. And for people to disagree that it doesn't exist means that it's a big thing to worry about.